I recently had a visit to a new dermatologist who wanted to freeze a precancer spot off my face. Now, for those of you who didn't bake yourself in the sun for years trying to get Irish skin like this to turn bronze, dermatologists will take a little spray can of liquid nitrogen and spray a couple squirts onto a spot to freeze it to stop it from turning into cancer. I quickly learned from the past medical bills I had that each squirt is quite expensive, and I feel like I could just do it at home. So when my new dermatologist reached for that can, I asked if it was really important or if I could do without it because each squirt is very expensive. And she said she had no idea how costly it was and told me it was only for cosmetic purposes this time and it wasn't pre-cancer. So she thanked me for letting her know, and then we discussed a bit about how doctors are unaware of the costs of some procedures and billing is completely separate. Therefore, they can't even let us know how much it will cost for the things they're doing to us. And most people in a hospital gown sitting in an exam room are going to just let medical professionals do what they say or need to do to you. Most people don't even question what they're doing or ask about the cost. But the older I get, the more I want to be in command of decisions about my own body. But that's for another post. Social media is allowing a huge audience to share information and personal experience quickly and gain knowledge regarding matters like this. Did you all hear that former U.S. Surgeon General Jerome Adams has gone viral for a social media post highlighting astronomical medical costs? He apparently had a recent visit to the ER for dehydration, receiving some labs and 3 IV bags, and the bill was just about $5,000 after insurance. It's no wonder medical debt is the top cause of bankruptcy in the U.S., Adams posted on X. Adams said on Morning in America, "My first thought was, oh my gosh, this is why 100 million Americans are in medical debt." Adams said his biggest concern is that skyrocketing healthcare costs are the leading cause of bankruptcy among Americans, and it can lead to emotional and mental health issues among those who can't pay their medical bills. Now he's advocating for change, calling the healthcare system financially crippling for most Americans. You think? Another issue, Adams said, is that the healthcare system is cost shifting, which means insurers and healthcare providers are charging more to people with greater coverage to make up for those people who don't have coverage or can't pay medical bills. That's the problem with the system, Adams said. Ultimately, it comes down to transparency. The American people need to know what they're going to be charged beforehand, Adams said. We need to have a fair process for people to be able to dispute charges. They hold a gun to your head. They literally say, if you don't pay these bills, we're going to turn you over to collections and we're going to ruin your credit. If I'm having difficulty navigating this, the average American doesn't stand a chance. I hope Congress, legislators, and regulators are hearing this, and I hope they will take some meaningful action to provide, again, to address these costs that are just completely out of control for the average U.S. consumer. Well, thanks for noticing, Mr. Adams. Your high-profile position may mean that people might actually listen to you, but it also demonstrates why things never change. This is what it takes for people like you to pay attention. You need to be directly affected, or you just don't think about how bad the problem is. Many people have the luxury of not really caring about how these situations affect the rest of us. And the people making decisions regarding insurance and the cost of healthcare can obviously afford it, or they would be working hard to make it affordable for all of us. But they're profiting from the system, so why would they change it? But what will it take for all of us to stand together and say no more, to demand change? How far will we be pushed? We're already pushing people into financial ruin, depression, and death. How much worse could it get? We're always waiting for the right politicians to come along, a hero to ride into town and save us. But maybe we need to be our own heroes. And maybe we need to save ourselves.